Now, in the first topic of our lecture, complications of suppurative otitis media, we will talk about the overview and classification. In this section, we will talk about some factors that influence the development of complications in case of suppurative otitis media. And then we will also talk about the pathways of spread of infection, classification, and also we will talk about the sequelae of otitis media. So first, the suppurative otitis media, it's mainly due to poor socio-economic conditions, and then also lack of education. Lack of education is very important factor, leads to suppurative otitis media. Ignorance. In lack of education, we can say people are usually ignorant, so they don't take special attention to any problems associated with ear. That can further aggravate the condition, and it can lead to suppurative otitis media, which has very, very serious complications. We will talk about those complications later on. So poor socioeconomic conditions and also lack of education are important in the development of suppurative otitis media. Also, another factor, as I mentioned, because a lot of people, they are not aware about the health care, how to clean the ear, how to, at what point they should see the physician or ENT specialist. That's an important factor. So all these can lead to suppurative otitis media. And then also lack of availability of trained specialists. We don't have in most parts of the world, especially in the developing countries, there is not all the areas doesn't have availability of ENT specialists. So when there are not special care available, then these simple sometimes problems like otitis media can lead to more serious complications and lead to suppurative otitis media. So all these are important factors that can ultimately lead to suppurative otitis media and further complications associated with suppurative otitis media. Here, if you see, this is the diagram of the normal structures. You have the behind the ear, this is the mastoid bone, and later on you will see when the complications occur as a result of suppurative otitis media, mastoid is very, very commonly involved because of very close relationship between the two structures. So this is the mastoid bone, then the cholesteatoma is present here, mastoid ear cells. This is the mastoid bone, and then very closely linked, you can see this is the middle ear, and then we have the ossicles in the middle ear. This is the another. So all these factors can lead to suppurative otitis media. Next, what are the factors that influence the development of complications as a result of suppurative otitis media? Age is an important factor. Then we already mentioned poor socioeconomic group. This is poor socioeconomic group. Different factors can affect, like malnutrition, and then this is the group who have like lack of education, lack of special care is also more common in patients who belong to poor socioeconomic group. So different factors can affect the patients who belong to poor socioeconomic group. Then there is virulence of organisms is another important factor. More virulent are the organisms, they can will have the ability to cause more serious disease. So virulence of organisms is another important factor. Then immunocompromised host. If the immune system of the patient is low, then even the organisms which are not very virulent or which are not very pathogenic, they can affect the patient also because their immune system is low. And patients who have low immune system, usually these are the patients who have illnesses like cancer, and they are taking chemotherapeutic drugs, and they have patients like diabetes and patients who are taking immunosuppressants. All these are the patients who are more prone to infections caused by not only virulent organisms but less virulent organisms also. Then we have the common organisms that can cause this suppurative otitis media, and the complications are Streptococcus pneumoniae type 3, then Haemophilus influenza, Pseudomonas aeruginosa, and Staphylococcus aureus. So these are some virulent organisms that can cause infection in patients whose immune system is not compromised. Then some preformed pathways are also common. If patient has already some problems like they have cholesteatoma, if there is perforation of the eardrum, all these can lead to more serious complications. So preformed pathways are also important. So all these are the factors that influence the development of complications in patients with suppurative otitis media. Then different paths through which the infection spread or infection reaches the middle ear is by direct bone erosion is one, in which the hyperemic process of hyperemic decalcification, osteitis, or erosion by cholesteatoma or granulation tissue. All these factors can lead to erosion of the bone, and this erosion of the bone then can lead to different complications. So hyperemic decalcification, if the calcium of the bone is decalcified, that leads to erosion and weakening of the bones. Osteitis is inflammation of the bone, so that can also cause leads to as a result of direct bone erosion. Then granulation tissue and cholesteatoma also can cause bone erosion. The other factor that can cause that leads to spread of infection is by venous thrombophlebitis. Thrombo is for the thrombus or blood clot, and phlebitis is phleb is for the veins, itis is inflammation. So inflammation of the veins as a result of blood clot formation also is the path for the spread of infection. And this is infection from the mastoid bone can cause thrombophlebitis of venous sinuses and even cortical vein thrombosis. So due to, as a result of spread from the mastoid bone, this can lead to thrombophlebitis, and from these clotted veins, infection can spread when the blood flows through these veins. So that's another path of spread of infection. Then the preformed pathways, as we mentioned in the previous slide, preformed pathways also lead to the spread of infection, and these are usually congenital dehiscence, patent sutures. If they are not closed, they are patent, infection will spread. Previous any skull fractures, surgical defects, oval and round windows, and infection from labyrinth. These are all preformed paths. Some of them are congenital, some are acquired, like surgical defects and fractures of the skull. So all these are the pathways of spread of infection. Here you can see this is the inner structure. This is the tympanic membrane, eardrum. At the eardrum, external auditory canal or meatus end at the eardrum. After this is the middle ear, and there are the ossicles, bones of the middle ear. Then we have the oval window and the round window. So all these pathways are important for the spread of infection. Then this is the diagram that shows you different complications of otitis media. We have cerebral abscess. If the infection reaches the brain, all these structures are interconnected. So if there is suppurative infection, it can spread to the brain and lead to cerebral abscess, cerebrum. So cerebral abscess. These are the meninges of the brain and spinal cord. Meninges are the layers or the covering that covers the spinal cord and the brain. So we have meninges of the brain. This is the dura mater. Then we have arachnoid mater, and this is the pia mater. So all these are the brains of layers of or the coverings of the brain and spinal cord, known as the meninges. When the infection spread to these meninges, it leads to meningitis. So meningitis is the inflammation of the meninges, which are the covering of the brain and spinal cord. So meningitis is the inflammation of the meninges. There are 3 layers of meninges. We have the pia mater, then arachnoid mater, and then the dura mater. So pia, arachnoid, D is for the dura. All these, and when the infection reaches these meninges, it causes meningitis. And then we have other complication that can occur is the subdural abscess. Sub means under, dura is the layer of the meninges. So when infection or abscess forms under the dura, it's known as the subdural abscess. This is the subdural abscess. Then we have extradural abscess outside the dura, extradural abscess. Then other complication can be lateral sinus thrombosis, lateral sinus thrombosis, cerebellar abscess when the infection reaches the cerebellum. Then the involvement of the mastoid bone leads to coalescent mastoiditis. And if facial nerve is involved, then the patient might have facial paralysis. And then we have labyrinthitis. So very, very serious complications of suppurative otitis media. Suppurative is formation of pus, discharge. It's a serious condition, and when it spread, if not treated properly, infection reaches the bloodstream, and then when blood flow occurs to different parts, it can cause infections, septicemia. When it can spread to different parts of the brain and spinal cord, it can cause different complications. All these complications are very serious. As you can see, cerebral abscess, cerebellar abscess, there is facial paralysis, there is the face turns to one side, there is meningitis which can lead to fever and rigidity, and different complications can occur. And all these are serious complications, need to be treated urgently. Then the classification of the suppurative otitis media, it can be, or the complications of suppurative otitis media, depending on whether it's intratemporal or intracranial. So classification: intratemporal. Temporal is the bone of the skull, this region very close to the ear, so it can involve the temporal region. And then intracranial, when it involves the cranium or the skull. So intratemporal is mastoiditis, Petrositis, facial paralysis, labyrinthitis. So all these are the complications that occur when it is intratemporal. Intratemporal can be cause mastoiditis, inflammation of the mastoid bone. It can cause petrositis, inflammation of the petrous bone. And then it can cause also facial paralysis because of the involvement of the facial nerve. And then labyrinthitis, which is the inflammation of the inner ear. If it's intracranial, then it can cause extradural abscess, subdural abscess, meningitis, brain abscess. So all these are the complications due to intracranial involvement. All these abscesses are the areas present in the brain. So extradural, subdural, meningitis, brain abscess. So we have intratemporal complications and intracranial complications can lead to different complications like mastoiditis, petrositis, depending on which area is involved as a result of complication, whether the temporal area is involved and whether the cranium is involved. Lateral sinus thrombophlebitis also can occur as a result of intracranial complications. And then otitic hydrocephalus. All these are the complications as a result of intracranial involvement. Next, sequelae of otitis media. Otitis media actually is the inflammation or infection of the middle ear. When it is simple otitis media, is the infection which is in the middle ear or infection of the middle ear. So should be differentiated from the complications that occur as a result of suppurative otitis media. There is a difference. One is localized to the area of middle ear, the other as a complications which are more very serious condition. So direct sequelae of otitis media can be as a result of perforation of tympanic membrane. When there is perforation of tympanic membrane, infections or microorganisms can reach the middle ear very easily and can lead to otitis media. Ossicular erosion leads to otitis media or as an otitis media. Then atelectasis and adhesive otitis media. Tympanosclerosis, which is hardening of the tympanic membrane as a result of otitis media, as a result of perforation of the tympanic membrane. Then cholesteatoma formation, and then conductive hearing loss due to ossicles erosion or fixation. These are all the sequelae of otitis media. They should be differentiated from the complications of otitis media or suppurative otitis media, which are very, very serious. We mentioned before they can cause subdural abscesses, cerebral abscesses, extradural abscesses, meningitis, and mastoiditis, labyrinthitis. So if you can see, complications are very, very serious, but simple otitis media can lead to conditions like perforation, tympanosclerosis, cholesteatoma, atelectasis, and hearing loss conductive due to effect of or the erosion of the ossicles, which are the present in the middle ear, incus, stapes, and malleus. So all these are the sequel of otitis media, not the complications. And then sensory neural hearing loss also. So all these are as a result of simple otitis media, not the complications of suppurative otitis media. So that was all about our first section, in which we talked in detail about the overview and classification of complications of suppurative otitis media. Thank you for watching sqadia.com.